Welcome, everyone. I'm Dr. Eric Karchmer, Chief Chinese Medicine Officer at DAO Labs. And I'm here today for another webinar. We were delayed a week because of the hurricane last week where I lost power and internet. So we're doing it on the second Wednesday of this month. But in the future, we hope to be back to our first Wednesday of the month schedule. And this month, the topic is menopause. So the title of this talk is Supporting Menopause with Chinese Herbal Medicine. So I'm thrilled to kind of share a little bit of my experience here with you and how we think DAO Labs can help you with this really tricky issue in women's health. So let's get started. So here's a quick overview of topics for this lecture. I'm going to talk a little bit about menopause and then give you some details on the kind of Chinese medicine perspective. So I think these are some important theoretical points that will really help you strengthen your ability to handle these types of patients. And then we'll talk about some treatment strategies. That's also very important, not totally obvious. Just from kind of the theoretical foundations. And then I'll give you a couple formula combinations, a few alternative formulas to kind of keep in mind. And we'll kind of just conclude quickly with a little bit on future events and how to stay in touch. With that, let's begin. Today's webinar will probably be slightly shorter than some of the other ones. Because of the delay, I'm now actually on the road and traveling and doing this at a not my usual location. So I've kind of tried to keep it short and sweet this month. So first, what is menopause? Some folks don't even love this term, but nonetheless, I think it's as medicalized as it sounds. We want to keep in mind that it's a name for a natural process that all women experience as the monthly cycle gradually comes to an end. This most often happens sort of between ages of 45 to 55. It can be a little bit later for some women. It can be earlier due to a number of reasons. But more typically, it's going to be in that age range. Menopause is just the term itself seems to kind of pathologize this process, and it really doesn't have to be. It really shouldn't be. I think that's our job as practitioners is to make it as let's say physiological as possible, as natural and as smooth and as easy as possible. However, as studies show that as many as 15% of women seem to really struggle with this transition in physical and emotional ways. And there's a lot we can do in Chinese medicine to facilitate this process, and again make it as natural, as easy as it should be. Oops, sorry. I apologize. Here we go. So just a few of the basics. What's happening when women get to this stage in their life? Well, one thing happens to all women, and that's that there is going to be a gradual cessation of menstruation. That does come to an end. That is a sort of physiological, biological fact that. And it will roughly happen in that window, typically 45 to 55 years. So that is the one thing that sort of all women change. Now, as part of that, there's going to be some other menstrual changes, and this definitely varies from individual to individual. Some women may have cycles that become longer. Some may have cycles that become shorter. The length of the period can change, sometimes dramatically. It may shorten. It may lengthen. And blood flow can start to become irregular, perhaps heavy, perhaps light, with lots of spotting. And some of that depends on where the individual was at before all of this begins. And then there's lots of other symptoms that can accompany these menstrual changes. And these sometimes are worse than the menstrual changes themselves. This mood fluctuations, sleep disturbance, hot flashes, night sweats, other skin changes, urinary complaints, sexual dysfunction, and more. So those are sort of but that's sort of a brief overview of the sort of things we're trying to manage. How do we manage it is kind of the question now in Chinese medicine. So let's kind of get into that perspective. So I'm going to talk a little bit about the ideas of root and branch here. And the root of menopause, of this biological transition, is a gradual decline in one's kidney qi. That's the Chinese medicine explanation. So the kidneys are understood as the source of reproductive fertility for both men and women. And their decline is inevitable, and it's really necessary as part of the aging process. So there's nothing pathological here. This is just going to gradually decline. But almost more important than the root is actually the branch. And so these changes in kidney qi lead to imbalances in the branch organs. And here we're talking in particular about the liver and the heart. So if decline in kidney qi, which again, as we're saying, is sort of physiological, if that's influenced by any number of factors, and that can be chronic illness, surgeries, and I find in particular sort of gynecological ones, diet and lifestyle, emotional stresses, environmental factors, a whole host of things, including one's own constitution. These can really lead to these more serious imbalances, particularly in the liver and heart. Those are the two organs we will really look for to help understand these symptoms. So what would those disturbances of those branch organs, heart and liver, look like? Well, the heart, we know, is source of spirit. So an unsettled spirit will lead to disrupted sleep, excessive dreaming, heart palpitations, anxiety, lack of mental acuity, all those things associated with a unsettled spirit. The liver can have some different kinds of presentations. Perhaps there might be rising liver yang. That can lead to headaches, dizziness, irritability, angry outbursts. Perhaps it's more constrained liver qi, and then we see some real emotional volatility, discomforts in the abdomen and flanks. And then this isn't quite, I wouldn't quite put this in either one of the characters, but one of the classic symptoms of menopause are hot flashes, and that's sort of more closely linked just to sort of yin deficiency in general, and that comes about often with sort of decline in kidney function. So kidney qi changes, perhaps presenting as kidney yin deficiency, leading to hot flashes. Those are sort of our disturbances in the branch organs. What are our treatment strategies? So here there's I think a couple things to keep in mind, and a couple little tricks. So if we understand the importance of the kidney, heart, and liver, we're partway there, but we're not all the way there. And then sometimes we get a little bit confused, this idea of the root. It makes us think that's more important in our treatments. But I would recommend actually focusing a little bit more on the branch organs. So we want to make sure we're treating heart and liver. And then we also may be very important to treat kidneys, but don't just treat the root organ, don't just treat the kidneys. And then on top of that, there's one other kind of little trick that's very important, is we don't want to forget about the spleen and stomach. So why are spleen and stomach also important here? There's a couple of explanations, but they themselves may be kind of the key to like really addressing menopause symptoms. So one, spleen and stomach, as we know, they produce qi and blood. And it's sort of an abundance of qi and blood. That's going to be really the only way to slow and modulate and ameliorate sort of the inevitable decline of all the organs. So spleen and stomach help keep, they're at the center, they help keep qi and blood robust, and that helps with everything. Then we also know liver qi constraint can then kind of further like impair the function of these two orders, so these two organs. So again, a robust spleen and stomach can also then inversely kind of like help not let liver qi become overly arrogant, and keep it flowing smoothly. And then also, separately, the spleen is also sort of a kind of like a mediator. It's a facilitator in the communication between the kidneys and the heart. And so kidney-heart communication is one element of some of these branch presentations, the imbalances of the heart. So spleen helps facilitate that kidney and heart communication, and so can be very important in that respect for helping to again address the kind of the key organs. So the key here is sort of not to forget about the spleen and stomach. So what does that look like in terms of treatments? Well, oops, sorry, I've jumped ahead. I apologize. Let me talk about one, I think, formula combination that I really recommend and that we recommend here at DAO Labs, which would be our two formulas, emotional balance and physical tranquility. That's also Xiaoyao San, or Free and Easy Wanderer, and Tianwen Buxin Dan. These two formulas actually can work really quite effectively together. So Xiaoyao San, as our emotional balance, as many of you know, addresses liver qi constraint, spleen qi deficiency, a little bit of liver blood deficiency. And so it can be getting at some of the liver issues quite effectively, and also helping with, again, supporting the spleen and stomach. One interesting point is that it can also benefit the actions of physical tranquility, or Tianwen Buxin Dan. So let me come back to the key point on the bottom left there in a moment and turn to Tianwen Buxin Dan for a second. Tianwen Buxin Dan is a classic formula for dealing with the deficiency of the heart and blood. And so it's going to facilitate, heart and kidneys. So it's going to facilitate heart-kidney communication. It also treats sort of blood deficiency more broadly. And our version of Tianwen Buxin Dan, and I'll have a slide in a moment to help you see this, is slightly different than the classic version of it that we typically use, learn about in textbooks. And it's actually one that I think is probably more beneficial for treating patients with menopause and addressing particularly some of the heart patterns that we see with that. And the reason why I think emotional balance is a good fit with physical tranquility, or Xiaoyao San with Tianwen Buxin Dan, is that Xiaoyao San contains Baiju, Atractylodies, and Fuling, Poria. These are two herbs that supplement spleen qi, and so they can help improve the heart-kidney communication properties of Tianwen Buxin Dan by again addressing spleen qi. So for the reasons we just talked about in the previous slide, the spleen helping to communicate between the kidneys and the heart. This can be a nice combination with physical tranquility, because not only is it sort of making improving sort of that heart-kidney axis, if you will, it's also at the same time addressing these issues of liver qi constraint, and so it can get to a lot of the symptoms of that patients often present with in menopause. It's because it's got both the heart and liver, these two branch organs, and it's also addressing the kidneys, but here spleen as well. So that's a nice combination, and I recommend it. We actually sell that. We call that the Menopause Bundle. I would say you want to kind of make sure that your patients really are a good fit for physical tranquility, because some other things can be going on. So let me give you some other formula choices that I think are useful here, and then we'll summarize the differences briefly. So another useful combination, I think, is women's formula and mental tranquility. And this is almost more of perhaps maybe more of like a perimenopausal sort of combination here. Mental tranquility, as our practitioners know, is Gui Pi Tong. Women's formula is Su Wu Tang. Gui Pi Tong treats, oops, I'm sorry, there's a mistake here. It does not treat deficiency of heart and kidney. It should be heart and spleen. My apologies. So it treats a deficiency of heart and spleen, and a lack of qi and blood. Women's formula, as you all know, is our classic formula for supplementing blood. But mental tranquility also has a property of governing or ruling the blood. And so this can be this formula can be particularly useful for addressing heavy bleeding and or spotting. So if the presentations of your patients are really more about the menstrual irregularities, in particular sort of heavy bleeding, spotting, then you might not want to go with physical tranquility. You might really want to focus in on mental tranquility to help deal with those menstrual irregularities. Since mental tranquility also treats the heart, some of the anxiety and sleep issues can also be addressed here. Women's formula, I mentioned this here too, because depending on how long the heavy bleeding and excessive spotting is going on, you may want to also at times use women's formula to supplement blood, to nourish blood, because there's a lot of blood deficiency is being caused by all this excessive bleeding. So some things that I may do is I may have patients on taking mental tranquility on a regular basis, but perhaps after the period, especially when the period's heavy, or sometimes even during the period, depending on how that's going, I may use women's formula to help really address the blood deficiency issues, which are most acute, during the period or after the right after the period. So that's another interesting combination. When to use this one versus sort of what we call the menopause bundle just depends on the presentation of your patient and how they're doing. But again, for me, when I'm really focused on the menstrual issues, and particularly if I see heavy bleeding, spotting, then my first thought is mental tranquility, and perhaps supplement with women's formula if necessary. Let's just look quickly at the formulas. This can be a little bit confusing. Mental tranquility is the same as Gui Pi Tong, and we've got kind of we use sort of the classic version of this formula. Our version of Tianwan Buxing Dan is slightly different than the one you would encounter in your textbooks, and I don't know if this is as easy to read as I hope, but if you notice here, some of the names of the herbs have been italicized. Those are things that are new to this formula. So Shichampu is not in the classic formula. Fu Shen is not in the classic formula. Those two things help to nourish the heart. One big difference with our version of Tianwen Buxing Dan is that Sheng Di Huang, which is the chief herb and the more standard formula, is also in this formula, but I've italicized it because it's used in a much smaller amount. So it's a small dose of Sheng Di Huang. I think that's good because Sheng Di Huang is quite cooling, and in the conventional formula it's used in a very large dose. So here it's used in a small dose, and cooling herbs can be kind of damaging to the spleen and stomach. So I like the fact that this particular version of Tianwen Buxing Dan is going to be a little bit easier on the spleen and stomach, which, as I mentioned, is very important in dealing with menopause patients. We also add in this one also adds in Duzhong, which supplements kidney yang, and Bai Bu, which goes together with Diazhang, and they sort of open the lungs and again bring the herbs to the upper burner. And then you can see in the sort of brown color are some of the things that are shared between these two formulas, things that supplement qi and nourish the heart. And so that's just a reminder that both of these formulas are doing two important things that we want to do when we're treating our menopause patients, which is address spleen qi and address various heart patterns. Hopefully that's a little bit helpful, and that tells you a little bit about what's different about our particular version of Tianwen Buxing Dan. And then lastly, I think, you always have to do your 4 examinations and do a proper diagnosis. The tongue is extremely useful here. So really look carefully at the tongue together with all your other symptoms, and that's going to help you decide again, what's appropriate. So on the right is a sort of more of like a yin deficient tongue. You'll see this more classically right in the heart of menopause, with women really struggling with hot flashes. You'll see this more classically, not always, but so you'll see some of that yin deficiency, some of that redness there. And if you don't see a coding, or there's sort of more that geographic coding, then you know the physical tranquility is going to be a good fit, and you may want to go for the menopause bundle, physical tranquility with emotional balance. That's going to be a good fit. If on the other hand you see something more like on the left, a swollen tongue, pale, teeth imprints, moderate to light coating, no real signs of heat, then you're probably more in the mental tranquility realm. If then on top of that you see excessive bleeding, spotting, these menstrual changes, then really mental tranquility is where you want to go. And then you see what else you see. If you think blood deficiency symptoms are really strong, add women's formula in, particularly at the towards the beginning of the cycle, to really replenish and treat the blood deficiency. However, if you're really noticing a lot of liver qi constraint, mental tranquility plus emotional balance may be a great combination too. Be as always in Chinese medicine, we have to be kind of flexible with the way we are thinking here. So and if the tongue may be slightly different if you really have liver qi constraint on top of this heart and spleen deficiency. So you may end up with a slightly more narrow and a pointed tongue, kind of overlapped with this fat and swollen tongue. So be aware of some of the possibilities here, and again, think flexibly. So those are sort of my main tips for thinking about menopause, and this is a topic we could talk about in some great depth, but this is sort of just kind of a few ideas in a nutshell here. So hopefully this really gets you thinking, and there's really there's a lot you can do with Chinese herbal medicine. There's a lot you can do with sort of just our basic DAO Lab formulas. So please, try to put some of this to use in your practice, and you may find you've got some really beneficial results. So thank all of you for watching the seminar. We want to encourage you to stay in touch. Check out our Facebook group. Please follow our newsletter, The Pulse. And I'm going to kind of keep these monthly webinars going as a way to kind of help all of you build your practice and kind of get and keep it and enhance your practice during these unusual times of COVID-19, and hopefully we'll all be kind of finding our practices getting more and more robust as the weeks and months pass. So again, thanks all of you for joining in, and looking forward to seeing you next month.